So it's important to understand just how much blood exists in the capillaries. You can see that the effective cross-sectional area of the aorta is 2.5 centimeters. But look at the effective cross-sectional area of the capillaries. When you add up all the capillaries together, they have a cross-sectional area of 2,500 square centimeters. It's a huge area, right? The other relative sizes are listed here, but the capillaries contain the majority of the blood. Also, it's at a much lower pressure, right? In fact, the arterial pressures are the highest in the body. And as we get down to the capillary level, the pressure really falls off dramatically. The hydrostatic pressure, that is, the blood pressure. When we get to the capillary, other pressures are at work. Those are the oncotic pressure and the osmotic pressure. Those are the two pressures that work at the capillary level to move fluid and particles in and out of the bloodstream. Now, we can get an idea about velocity of blood flow when we look at the comparison between flow and area. So velocity is directly proportionate to flow. So the higher the flow, the higher the velocity, the higher the flow. I mean, either is true, right? But velocity decreases as the area increases. They're inversely related. And that makes sense, right? The velocity is going to be much slower in the capillaries than it is up here in the aorta and the large arteries. Okay, that's an important component to remember as well. Now, what determines flow? Well, the very important component of flow is not the pressure, but rather the pressure difference or the pressure gradient. Okay, and that's part of Ohm's law. Ohm's law says that flow increases with an increase in the pressure gradient, and flow decreases as the resistance goes up. All right, so you don't have to be able to do the math here, but you have to remember that anything that's above the line has a direct relationship with flow, and whatever's below the line has an inverse relationship. That's an important thing to remember. Basic math, right? Now, let's talk about turbulence of blood flow. We all like to think that blood just flows through the vessels without any turbulence whatsoever, and that's just not the way that normal blood flow works. Physiologists and engineers and people like that use Reynolds number, or RE, as the tendency for turbulence to occur. All right? When we have blood flow, it doesn't move like this. It moves like this, where the center column goes fastest, and then there's a little less speed on the next column out, and then it's even slower as the blood flows across the endothelial lining. So the turbulence is the proportionate velocity and flow with the diameter of the vessel. Okay? So the turbulence is proportionate to the velocity of flow and the diameter of the vessel. Turbulence is inversely related to the viscosity. So the more viscous the blood, the less the turbulence. The higher the viscosity, the lower the viscosity, the higher the turbulence. And you can make that make sense in your head. A gel is going to move through a tube with much less turbulence than water or something, that is less viscous. So all of that makes you wonder about resistance, right? I'm sure it does. Well, resistance is one of those funny things that we can't really measure. We have to calculate it. And when we calculate it, we get this bizarre unit of referring to resistance, and that is dyne seconds per centimeter to the fifth. You may also see it written as dyne second centimeters to the negative fifth, which just means that the centimeters to the fifth is above the line, and the negative sign means that it's inverse, right? You remember all that from high school. So these units are really weird, but you'll get used to dealing with them if you're a critical care nurse or acute care nurse practitioner, because we use them all the time when we talk about systemic vascular resistance and pulmonary vascular resistance and things like that. Now, the next thing to keep in mind about blood flow is that it increases exponentially with the vessel diameter. So the bigger the vessel, the much more blood flow occurs. Okay? And the reason for that is this exponent. So remember, anything above the line is proportionate to, so flow is F. And as the radius of the artery increases, the flow dramatically increases because the radius is taken to the fourth power here. Now, what slows down flow? Viscosity. Viscosity is the one thing that decreases flow. But the other thing to remember is that the length of the vessel also is inversely related to flow. That makes sense too, right? The flow will be decreased the longer the distance is that it has to go.